Good afternoon and welcome to today's webinar, Preventing Falls, What You Need to Know. Thank you for joining us today. My name is Barbara Chabner and I'm the Director of Education and Outreach here at the Brain Injury Alliance of New Jersey. BIANJ is a nonprofit organization with a mission to provide education, awareness, prevention strategies, advocacy, and support to those who have been affected by brain injury. We hope you will join us at our upcoming 5K walk, run, roll for brain injury awareness on Saturday, October 2nd in Paramus and West Windsor, and on Saturday, October 9th in Bradley Beach and Mount Laurel. More information can be found on our website, www.bianj.org, and a link will be put in the chat. Attendees' microphones and cameras have been muted and turned off. If you have any questions during today's webinar, please type them in the chat. We will get to as many questions as possible at the end of the presentation. The webinar is being recorded and will be available for viewing on the BIANJ website. At the end of the webinar, a link for a post-webinar survey will be placed in the chat. Value your feedback, so you're encouraged to complete the survey. You must complete the survey in order to receive your professional development certificate of attendance. It gives me great pleasure to introduce Dr. Cynthia Boyer, who is a clinical neuropsychologist with more than 30 years of experience in neurorehabilitation. Her professional career has focused on neuropsychological evaluation, psychological treatment, and cognitive rehabilitation of individuals with acquired and degenerative brain injuries and developmental disabilities. Dr. Boyer earned a BA in psychology at the University of Pennsylvania and an MA and PhD in clinical psychology at the University of Delaware. An accomplished clinician, Dr. Boyer also has a strong background in administration, strategic planning, program development, and clinical quality. Currently, Dr. Boyer serves as Chief Clinical Officer for Hope Trust, a technology-based trust company serving the special needs community, and maintains a clinical practice at the Head Injury Center at Eastern Neurodiagnostic Associates. Previously, she served as Executive Director of Brain Injury Services and Vice President of Quality and Academic Partnerships for Bancroft. Dr. Boyer holds faculty positions at Philadelphia College of Osteopathic Medicine and Widener University and is a trainer for the Academy of Certified Brain Injury Specialists. She serves on the board of New Jersey Brain Injury Alliance and is a medical rehabilitation surveyor for the Commission on Accreditation of Rehabilitation Facilities. Welcome, Dr. Boyer.
Thank you, Barbara, and thank you for joining us today. It's my pleasure to be with you. So, oh goodness, my thing isn't advancing. Oh, hang on one second. There we go. So many of you may know that this is actually Fall Prevention and Awareness Week throughout the country. And actually September 22nd was Fall Awareness Day. And as you can probably determine, September was selected because it's the beginning of fall. So it's to bring attention to falls and the impact they have on individuals, our society, and what we can do to prevent them. So probably many of you know someone who's fallen and are aware of how life-changing and life-altering for some people the falls can be. And if you have a relative or a friend, or perhaps even if yourself have fallen, you may wonder what can be done to prevent it. So we're really going to address all of those things today. You may be wondering why the Brain Injury Alliance is concerned with falls, or you may already know that falls have actually taken over motor vehicle accidents and motor vehicle collisions as the most common cause of brain injury. So falls are by far the leading cause of traumatic brain injury across age groups. The statistics are actually pretty daunting when you look at them. Every second, an older adult falls. Our talk today, we're going to talk a lot about older adults because, as you see, you'll see a little bit in the statistics that falls are much more common in older adults than younger adults, but the same preventative measures and the same consequences are present no matter what the age group is. So keep that in mind as we go forward. Not just that with the frequency, but about every 20 minutes, an older adult dies from a brain injury. So not only are they life altering for individuals who are injured, but they can be very serious and lead even to death for individuals. So let's think about what some of the top causes are. We're not really going to differentiate between slips, trips, and falls, but there are actually technical differences between all three of those if you're interested. And the causes of them are actually fairly obvious. Floors that are slippery, that's why they have caution signs. Poor lighting, we'll talk about that when we talk about, we'll talk about many of these when we talk about prevention. Not having the right kind of stair railings or not having stair railings at all. For people who live in the northern climates, when it gets to be wintertime and snowy, falls increase. Poorly placed rugs, throw rugs, scatter rugs are a big risk for falls and a common cause. And then uneven flooring or just slippery surfaces. I'll share with you that a couple of years ago, I actually had a slip and fall, and it was an uneven sidewalk that was sandy, and my foot just kind of went out from underneath me, and I broke my ankle. So it can happen really, really quickly. So where do most people fall? Most people fall outside of the home, a little bit more than half outside of the home. It does differ by age group. Younger people are more likely to fall outside the home in sporting activities or different things. Older individuals are more likely to fall inside the home. But you can see that chairs and ladders, stairs, uneven surfaces, bathrooms are all common sites of falls inside the home. And then outside, it's not really differentiated where it is. When we look at the statistics and the incidence of falls, we're really kind of smack within the middle of this infographic. And you can see that the number of falls is really increasing quite a bit. And when you think about the amount of time now that people are spending inside the home, perhaps it's even going up more quickly than it was anticipated. But if you think about 52 million falls in a little more than 9 years, that's a huge amount of falls with a huge amount of injuries associated with that, 12 million injuries. Just like the incidence is increasing, the death rate is also increasing for people. You can see this is not the type of graph you want to see where the line is going really kind of straight up. So we're really in a public health crisis when you think about it with regard to falls. And that's why it's so important to have Fall Awareness Week and Fall Awareness Day. This graph, although it's a little bit old and it's North Carolina, not New Jersey, gives you an idea of the change in incidence of falls over age. So it's not that young people don't fall, because you can see it goes down to age 20. They certainly do, but it's at a much slower rate, much lower rate than older individuals. And you can see after age 60, you see how sharply that line goes up in terms of the incidence of falls. You can also probably see here that females fall more often than males. And some of that is, these are sheer numbers. So some of that is related to the fact that women live longer, so there are more females to fall than males, but there is a little bit of a sex difference there. And we're going to talk about that a little bit as we go on as well. But you do see that there is a significant change in the incidence over time and as individuals age. What you can see on this graph is the mortality rate for individuals. And again, they're always lagging with these statistics, so it's hard to find more recent statistics. But even though, interestingly, even though it's more common for women to fall, women fall more often, fatalities are higher for men. So it may be that men engage in more risky behaviors, they're doing more household repairs and those types of things, so that the fatality rate, there's a difference for men and women, with it being higher for men than for women. So that gives you an idea of the scope of the problem, which obviously is rather large. But what are the consequences? Fractures are a big consequence. I mean, we let off with brain injuries are a big consequence. Brain injuries and actually spinal cord injuries as well. But I thought this statistic was rather interesting. More than 95% of hip fractures are due to falls. So for falls that occur within the home, the most common type of fracture that occurs is a hip fracture. For fractures that occur outside of the home, the most common fracture that occurs is usually a fracture of the arm, a fracture of the wrist, a fracture of the shoulder, with the individual trying to break their fall. So there's a little bit of a difference, but because more older individuals fall within the home, that hip fracture percentage is huge. When we talked about brain injury being one of the most common problems after a fall, what happens in a fall, I thought I'd kind of share this slide to get kind of the brain injury piece enlightened a little bit, is you can sustain what's called a subdural hematoma. So you see on the left image, the blood kind of accumulating in the space between the skull and the brain. So what happens is if there's a bleed, the bleed continues and just fills that space. And you can see in the lower right-hand corner what it looks like on a CAT scan. You see the brain gets kind of pushed to the side and shifted over. So what can happen in a fall, and we'll talk about this a little bit when we talk about the case studies at the end of this presentation with regard to brain injury, what can happen in a fall is a slow bleed can start in the brain that's not immediately picked up, and it accumulates over time. So one of the most common instructions you get from an emergency room after a fall, or one of the things that you should know after a fall, is that you don't want somebody to go to bed and stay asleep for a number of hours. You want to be able to see what their mental status is like over time, so that if there's a change in status, you can do something. Because as the blood accumulates in the hematoma and continues to kind of push the brain around in the skull, you'll see individuals become more confused, more disoriented. Their language doesn't make sense. So that can be a tip-off that something's happening. So someone can go to the emergency room immediately after a fall, be evaluated, and the CAT scan shows nothing because the blood hasn't had a chance to accumulate. In very severe falls, sometimes actually the CAT scan does show something immediately, but it's important to know that the consequences of a fall can have a lag time. And that's really, really important to know in terms of monitoring individuals. So let's go back to the rest of the consequences. One of the most common consequences for older individuals after a fall is nursing home placement. Sometimes if an individual has a hip fracture, they lose their mobility and they're not able to be independent in their home anymore. Another consequence, and we're going to talk about this a little bit later as well, is fear of falling again. And that creates a vicious circle. But nursing home placement, having change in mental status, depending on the type of head injury that may occur after a fall, having changes in socialization, isolation, can lead to depression, can lead to withdrawal. So it's not just the immediate after effects, the immediate physical after effects of a fall that impact an individual's life. It can impact social, economic, all kinds of things. So really pervasive effects of falls for individuals at all ages, but particularly for older individuals. We just saw that. So falls are very, in addition to the human cost of falls, economically, falls are very expensive as well. And these give you some ballpark estimates of what a fall can cost. Your typical emergency room visit is almost $5,000. If you look at the outpatient treatment that may be necessary after a fall, physical therapy, occupational therapy, maybe some doctor's visits, add another almost $6,000. And if somebody needs to be hospitalized, $30,000, maybe even more. And it's not uncommon for someone to be hospitalized after a fall, go home, have complications, and go back to the hospital. So the economic costs are very large as well. The previous slide showed you individual costs, but if we look at societal cost for falls, looking at Medicare and Medicaid and private insurance types of costs, you can see that billions and billions of dollars are spent taking care of people after they fall. So social costs, economic costs are huge for falls. The previous slides showed you some general kind of national information, but I was able to locate, I'm assuming most people here on the webinar today are from New Jersey. So I was able to locate some New Jersey specific information to give you an idea of what the scope of the problem is in New Jersey. And in 2018, which was the latest year that statistics were available, again, there's always a lag, there were 454 deaths from falls, 19,000 hospital admissions, and 82,000 hospital treated falls. So that includes emergency rooms and admissions. And then the bottom of the pyramid has a question mark because a lot of people fall and don't get attention. So that when we talk about risk factors later, some of these minor falls, if you want to call them that, don't get attended to. So the prevention measures are not implemented. And then repeat falls happen and more serious things happen. But for those of you in New Jersey, this is a good reference in terms of the incidence of falls and the costs of falls in New Jersey. So let's talk about what some of the risk factors are for falls. Some of the risk factors are things that you can't do anything about. Age, as we saw on the graph, is a risk factor. The older you are, the more likely you are to fall. Gender is a risk factor. Women are more likely to fall than men. And believe it or not, race is actually a risk factor. Caucasians are much more likely to fall than African Americans. I haven't found anything that I read that says why that is. But if you look at who's at highest risk for falls, it's white women. And if you look at who's at highest risk for dying from a fall, it's white men. And then kind of after those two groups, African Americans. These are things that you really can't do anything about. You can't kind of change your demographics. But if you're working with individuals and you kind of know where they fall in these risk groups, it helps you develop some preventative measures and preventative plans. So these are some of the factors that we may be able to intervene in when it comes to falls prevention. There are age-related changes that occur. As individuals age, muscles get weaker. As muscles get weaker, it affects your core strength it affects your balance, and your balance can lead to falls. Gait and balance disturbances can happen independent of muscle weaknesses, or they can be associated with muscle weakness, and certainly puts individuals at greater risk for falls. As individuals decrease in their body weight, and this happens often in older women, you'll see a sharp decline in weight and in body mass. They are at higher risk for falling and at higher risk for injury following a fall. Sensory changes also put people at significantly higher risk for fall. Vision is a big one. As vision gets less acute, and certainly acuity changes with age, it puts individuals at a higher risk for fall. Their depth perception changes. They are not seeing things in the environment, so they don't see obstacles. They don't see things that are in their way. For individuals who have conditions such as macular degeneration, their vision is very impaired. So they're at a much higher risk for fall because other than peripheral vision, they have very low vision. Hearing impairment also is associated with falling, not to the same degree as vision, but is associated with falling in that individuals are not hearing stimuli in their environment, and or they think they're hearing stimuli in their environment, so they are responding more quickly to things because there's a lag time, and that can put them at a greater risk for a fall. Neuropathy is a big fall risk. So neuropathy, for those of you who are unfamiliar with it, is loss of feeling in extremities. And in particular, for fall risk, it is loss of feeling in the feet. So if you have neuropathy due to a medical condition, diabetes usually, you have less feeling in your feet. If you think about it, if you have less feeling in your feet, you're not going to be as sure where you are. You're not going to feel uneven surfaces, perhaps, put you at greater risk for fall. Proprioception, or kind of that spatial orientation and spatial knowledge that our brain kind of projects for us, kind of knowing where your body is in space, can decline with age as well. And if you're not kind of sure where you are spatially, it may lead you to step incorrectly, miss a step, miss a curb, miss something in the environment. Medical conditions, there's certain medical conditions that cause dizziness and vertigo. Cardiovascular disease is a risk for complications as well. It can lead to what's called orthostatic hypotension, where when you get up quickly, your blood pressure goes down really quickly. So you may be a little dizzy or have a little bit of kind of almost like a little blackness when you get up fast. And then some neurological conditions such as Parkinson's disease, a previous brain injury, dementia is a risk factor. The thing to keep in mind as we've gone through all of these risk factors is usually in older individuals in particular, these do not happen kind of in a unitary manner. Usually older individuals have multiple risk factors, and younger individuals who've had severe brain injuries have multiple risk factors of muscle weakness, vision problems, and dizziness. So it's very unusual and very rare for these factors to occur by themselves. Other risk factors that are present, and these are more manageable types of things. Medications are a huge risk factor when it comes to falls. And really, the types of medications that present risk factors run the gamut, from blood pressure medication. And we just talked about cardiovascular risk factors and orthostatic hypotension. A lot of individuals are on blood pressure medication, but one of the risks of blood pressure medication is that orthostatic hypotension, a little bit of dizziness. Cardiac medications have dizziness as a side effect. Many of the psychotropic types of medications that individuals take, whether it be an antidepressant, an anti-seizure medication, an antipsychotic, have drowsiness as a side effect. Pain medication has drowsiness as a side effect. And drowsiness interferes with alertness, interferes with your perception of the environment, and can put you at higher risk for fall. Another medication that I want to mention that really increases, not so much increases the fall risk, but increases the risk of complications following a fall, is any type of anticoagulant medication. So for individuals who have arrhythmias or who've had a valve replacement, who are on heparin or warfarin, any of the anticoagulant medications, thin your blood. Remember that picture of the subdural hematoma that I showed you a couple of minutes ago, where you see the blood collecting in the space between the skull and the brain? For individuals who are on anticoagulant medication, they're at a higher risk for having bleeding after a fall and for having more bleeding after a fall. So if you know that somebody is on that type of medication and they've had a fall, they really need to be monitored very carefully. Then let's look at the personal factors. Footwear is a huge factor when it comes to falling. So not having the proper fitting footwear is a problem, too big, too small, but also not having the right type of footwear. How many people walk around their home in their stocking feet or in their bare feet? Doesn't give you very much traction in terms of being able to steady yourself if you lose your balance. The best type of footwear is something that has some sort of kind of anti-skid type of backing. But in the house, it's important for people to wear something on their feet. Interestingly, some of the athletic footwear actually is not so good for preventing falls. And the type that's not so good are the types that have really kind of thick soles, so that you don't have as good of a kind of feeling between your foot and the ground. But making sure that individuals wear some type of footwear and the right type of footwear is important in terms of prevention. Inappropriate walking aids. Usually that means no walking aids for people who should be using a walker or a cane. Or, perhaps they're using a walker that has wheels and they shouldn't be using a walker that has wheels. Obviously, that's going to lead to some problems. Nocturnal voiding or needing to use the restroom during the evening is a risk factor, because when people get up during the night, many times they're a little bit groggy, not really totally awake. Many times they don't turn the light on. And the more times you do that, you kind of risk your luck. And the more times you do that, the more likely it is that you're going to fall. If it's somebody who sleeps throughout the night, that's not a risk factor for them. Then the environmental hazards, and we're going to talk about this when we talk about prevention as well. Throw rugs are a huge risk. They slip, they slide, they don't usually have backing on them. Lighting, we mentioned lighting in terms of getting up at night, but lighting at any time of the day. If your vision is decreased, you need that extra lighting to be able to see your environment and see the risks in the environment. And then things like electrical cords or clutter are also a risk factor. They're a tripping hazard, obviously. So when people do fall, it actually puts them at increased risk for another fall. Many times when individuals fall, they become a little more fearful of falling, so they reduce their activity level. When they reduce their activity level, their strength decreases more. As their strength decreases, their balance decreases. They kind of feel more wobbly and less sure. So they're not only afraid of falling again, now they're not as physically fit, and they're much more likely to fall a second time. So it's for folks who have individuals in their family or individuals that they work with who've fallen or who have fallen themselves, it's very, very important to break this cycle of avoidance, because it actually makes you much more likely to fall again in the future. And like anything, the more often you fall, the more likely you're going to have a negative result and a negative impact of the fall. So those are the statistics and the risk factors. I think when we talked about the risk factors, it's a little bit on the obvious side about how to prevent them, but let's walk through that anyway. So I don't know if this looks familiar to anybody, or if you can kind of identify what some of the environmental hazards are here. You see a cane on the floor, you see a rug, you see clutter, you see a cord. High risk environment for falls. One of the things that you can do if you are working with individuals or if you have family members is some sort of mini analysis of the home to determine how safe the home is and to be able to start to eliminate some of the risk factors that we talked about. You can't always eliminate every single thing, but the more of these that you can pay attention to and the more that you can eliminate, in the case of clutter and cords and so forth, and ladders. Older people shouldn't have ladders in their house if you can convince them of that. Or improve, in the case of lighting, the more likely you are to decrease the possibility of a fall. So some pretty obvious tips here, but if you're in a place that does not have railings on the staircases, you want to have railings. If you can have railings on both sides, that's actually preferable, but one side is better than nothing. You want to make sure that you've got lighting, that you're picking up clutter, that you don't have a lot of loose cords falling around. Bathrooms are one of the biggest sites of falls, so you want to make sure that there is a non-skid mat inside of the tub or shower and a non-skid type of mat right outside of the tub or shower. So those are the environmental things that you can change. What are some of the individual kind of healthy things that people can do? So we talked about medications. It's important to review medications with your healthcare provider and understand what the side effects are. Sometimes if there are a number of medications that the individual is prescribed, some of them can be eliminated. Sometimes there are dosage time changes so that the side effects are less problematic for people, but you have to have a conversation with your healthcare provider in order for that process to get initiated. Having regular vision checks, at least annually, vision should be checked and adjusted. We talked about shoes and the importance of wearing shoes with traction. Having a good diet with lots of protein. It's not listed here, but actually staying hydrated is important because dehydration can increase confusion and dizziness. So staying hydrated is very important as well. And exercising. exercising to ensure that you keep your core healthy and strong is going to help you be able to right yourself when you start to lose your balance a little bit. I want to put a pitch in here for a program that's called A Matter of Balance. This is an evidence-based physical program that provides exercises and information for individuals to be able to prevent falls. This is actually a program that the Brain Injury Alliance sponsored, and in pre-pandemic days, they were able to offer this at some senior living facilities and in the community, and hopefully they will be able to offer this again in the not too distant future. But any type of exercise that strengthens the core is going to be good. Tai Chi is another good example of a type of exercise that works to strengthen the core of individuals and helps them be safer so that they are less likely to fall and or more likely to be able to catch themselves if they start to fall. So there are a number of tools out there that I wanted to share with you that you can use for assessment of family members, assessment of individuals who you may work with, or even self-assessment if you need to. And this is one example of a little checklist that you can go over to determine kind of what your risk is for falling. And not just what your risk is for falling, but if you look at the why it matters side, you can then take that and extrapolate to what you can do to prevent that, or what you can do to address that problem. So even for somebody who may only answer yes to one of these questions, which doesn't really put them at an extremely high risk for falling, they can start to think about what they can do to mitigate that risk factor. And if you see that there are multiple yes answers to this, it can prompt you to really have a discussion with your healthcare practitioner or the healthcare practitioner for the individual that you're working with to come up with a comprehensive approach to preventing falls for this particular individual. So the CDC has a wonderful program, and actually a few of the slides that I used earlier in the presentation were taken from the CDC. They have a program called STEADI, which is eliminating injuries in the elderly. And they have all kinds of online training, video presentations. They have if you're a pharmacist, I don't know that there are any pharmacists on this talk, but if you happen to be a pharmacist, they have a special training specifically for pharmacists around medication. But there is a wealth of materials about falls and falls prevention available free of cost. That's the website for these resources, and these show you some of the actual brochures that they have. Checklists for safety, things that you can do to prevent, talking about hypertension, which we talked about as a big risk factor. So these are really, really good resources if you're looking for something in terms of education and prevention. Another good resource is the National Council on Aging. And similar to the checklist that I showed you about assessing falls risk, they actually have an online version of that where you answer, I think it's 10 or 12 questions that you answer, and it will give you an assessment of what your risk is, and then give you some tips for how to prevent that risk. So this is another really, really good resource. The state of New Jersey has a falls prevention work group for your information. And this was established a number of years ago. The contact information is here. Heather Taylor is the state coordinator, and she is within the Division of Aging Services, but they provide information as well. They have a toolkit for falls awareness. That's where the statistics came from. They have trainings, they have posters you can download. They also work with A Matter of Balance and some other types of exercise programs. So for folks who are within the state of New Jersey, this is another excellent resource for you in terms of information and resources for prevention. So I want to just kind of end with two little case studies. So one of them is for an 80-year-old individual, female individual, very petite. She was probably 4'11" and very active woman. She was active in theater. She was active in her church. She went to exercise class. She had AFib, so she was on anticoagulant medication. She had her knee replaced, so she was a little less facile in terms of ambulation. And she also had mild cognitive impairment, so slightly declined in mental status, but not a huge decline. She was at her son's home, and they were walking outside of his home to kind of see the new addition on his deck. And there were a few steps down, no railing there. And she slipped and fell and hit her head. They went to the emergency room, gave her a clean bill of health. She had, her son lived in Virginia. She lived in New Jersey. She had gone there by bus. She took a bus ride home. By the time she got to Trenton, which is where her daughter lives, when she got off the bus, she was talking, but she wasn't really making any sense. It was kind of all gibberish. So her daughter thankfully took her to the emergency room, where they found that she had a very large subdural hematoma. So again, that kind of bleeding over time. She needed to have it surgically evacuated. After the surgery, she remained pretty confused. She went to inpatient rehab. She went to subacute rehab. She never really regained the same level of cognitive functioning that she had. She certainly was not as confused as she was post-surgery, but she now met the criteria for dementia. So she progressed from mild cognitive impairment to dementia because of the brain injury from the fall. She didn't have any other broken bones, but because of this, she was no longer able to live independently. She needed to live with her daughter. She needed to stop driving. Because she needed to live with her daughter, she moved, so she lost her social network. So this is an example of really a not so good outcome from a fall. So what could have helped in terms of prevention here? I don't have information about what type of footwear she had on, but obviously had there been a railing where she went down the steps, or if somebody had escorted her down the steps, and it wasn't a lot of steps, it was only a few steps, that could have gone a long way in terms of preventing the fall. So I want to give you a happier case study to end with. So this is an individual in, I don't know his exact age, but mid-50s, a doctorate in international studies, had a important position at Princeton in the Woodrow Wilson School of Public Policy. I think they may have renamed it since then. He was in Manhattan in New York City, and he slipped on a curb and fell and hit it and bumped his head. Got himself up, brushed himself off, embarrassed because he fell, and kind of went along his day. Didn't have any treatment, nothing. A few days later, his wife and his executive assistant noticed that he just didn't kind of seem quite as sharp, didn't quite seem like himself. So they convinced him to go to the emergency room. He went to the emergency room, had a CAT scan. Lo and behold, big hematoma pressing on his brain. Had surgery, had the hematoma evacuated, had an excellent recovery, went back to work, went back to all of his activities. Most likely age played a role here, but two examples of falls and not really severe falls, one on a curb, one down a couple of steps on a deck, and really kind of both could have had very tragic outcomes. But you see the difference in outcome kind of based on age. So certainly older individuals most likely and most usually have a worse outcome. But for the younger individual, had they not sought treatment, it actually could have been much more serious in terms of brain damage or perhaps even fatality if it went along for too long. So very important to follow up and to follow up over time, even for seemingly mild injuries. So I want to leave you with one last thing. This is through the state of New Jersey, and it is a little activity for Falls Awareness Week. It gives you some information. It has a little crossword puzzle and a word search. So this is something you can look for on their website and either use yourself or use in a program where you may be working. And I want to thank the Brain Injury Alliance for inviting me to present. This is some information about the Brain Injury Alliance. They are a wonderful resource for any type of brain injury, whether it's related to a fall, a motor vehicle accident, a medical condition. Excellent resource. And as I mentioned, hopefully they'll get back to providing a matter of balance so that that is a preventative measure that we can endorse and support people with. These are our information about how to connect with us. And I want to thank you for spending part of your lunch hour with me. Barbara?
Thank you very much, Dr. Boyer, for your presentation and sharing your expertise with us today. There is one question in the chat. If anybody else has questions, please pop it in the chat. We have time for a couple of questions. So this question goes to one of the earlier slides that you had about the types and causes of falls. So the question is, does the distribution of the causes of falls change for men leaning more towards unusual physical activities compared to everyday life? So I guess that would be doing, like sports or other kinds of physical activities that are not just, something we all do typically in a day.
The answer is I think so. I couldn't find a direct reference for that, but the explanation for the graph that I showed did explain that men tend to engage in more types of high risk activities and more kind of physical activities, if you will, than women. So there are some sex differences in the location of falls. I don't have statistics breaking it down that way, unfortunately. They were kind of hard to locate, but yes, absolutely.
Okay, thank you. Anybody else has any questions, please put it in the chat. In the meantime, I want to say that at the moment we are not doing the matter of balance, but we do presentations on fall prevention for seniors in senior centers. So if anybody is ever interested in that, please, you can contact me at bchabner, BCHABNER at BIANJ.org. I'll put it in the chat. We'd be happy to do a presentation at a senior center or any other location that that you would like. I did put in the chat earlier the website link for our upcoming 5K run, walk, roll. And I'm going to put in the chat a link for the post-survey evaluation. Again, I encourage you to fill it out. And if you want to receive your certificate of attendance, you do need to fill it out. One last call for questions. And if there aren't any, I want to thank you again, Dr. Boyer, for your time and sharing all this wonderful information with us. And please feel free to reach out to us if there's anything that we can do. Putting my email address in the chat. And this concludes today's webinar. Thank you for hopping on today, and we hope you'll join us for webinars in the future. Thank you.